Good morning. We will just wait I think people are coming on now. So it is 12, and as people are rolling in, we will just go ahead and start. Welcome today. My name is Amanda Vikstrom. I'm the Executive Director at the Minnesota Elder Justice Center, and we are excited to have Sean Burke with us, and so many of you with us as well to learn about and to discuss via the Q&A. Feel free to ask questions. What's on the forefront for sort of state policy in the elder justice world and things that the Minnesota Elder Justice Center will be working on this legislative session. So just by way of introduction, the Minnesota Elder Justice Center is a statewide nonprofit. Welcome. We're assuming if you're here, you know about us, but if this is your first time joining us, we're glad to have you. We do trainings like this every Thursday. Part of our mission includes work to provide professional education and public awareness around elder justice issues. We do work in the public policy systems change arena, and we also provide direct service for those experiencing abuse, neglect, financial exploitation for older adults and vulnerable adults. To access a victim services advocate for you or someone you know, you can call our victim services helpline 651-440-9312. You can also get that information on our website. Our free weekly webinars are typically on Thursdays at noon. It's a new time for us in this new year, trying them at noon. You can see on the screen the upcoming webinars that we have. We're going to be talking about financial exploitation in marriages, about gray matters, understanding depression in older adults, and hearing from the Disability Law Center later in February. Our webinars are free and CEUs are often offered. They're offered whenever we can. Please feel free to see our upcoming webinars and sign up for them on our website. So today, all attendees will be on mute. We do encourage participation. Please use the Q&A box for any questions for Sean or me. We will try and work in all the questions or as many as possible. And you can use the chat box for any comments or questions that you have about CEUs or comments for us. If you would like the closed captioning, the auto-generated captioning is available under the live transcript button at the bottom. And slides and search CEUs will be sent after the webinar today. The recording will also be available if you would like that. And at the end, you will be able to provide feedback to us through a survey. So please fill that out. We do take into account what you share with us and try and make improvements or offer other sessions. For the post credit, I do have to read this, so bear with me. Post credits, the Minnesota Elder Justice Center is a continuing education sponsor as approved by the Board of Peace Officer Standards and Training. This course, Elder Justice Policy Part 2, the Adult Protection System and Other Elder Justice Issues in Minnesota, 104290017, has been approved by the Post Board for 1 continuing education credit. Peace officers who successfully complete this course will receive 1 hour of continuing education. The sponsor of this course has a written policy for the investigation and resolution of allegations of classroom discrimination. This policy applies to all faculty, instructors, administrative staff, and students, and a copy of the policy may be obtained from the sponsor by contacting Renee Strami at renee.strami@elderjusticemn.org. Today, I will be with you, Executive Director of the Minnesota Elder Justice Center, and I'm thrilled to have Sean Burke with us as well. Sean is turn this end the show so I can see you all and stop sharing. Sean is a consultant on behalf of the Minnesota Elder Justice Center. So he works with us on policy issues, legislative issues, systems change. Many of you know Sean from his earlier work with us as a staff person, as our public policy director in prior years, and before that as a board member. So Sean has been working with us for a long time, and we're thrilled to have him again here today with us to talk about what's coming up in this legislative session. So with that, I will turn it over to you, Sean, and I would encourage the audience to please feel free to drop your questions into the Q&A at any time, and we'll work them in as we can. I'll interrupt Sean, or we'll get to them at the end. So take it away, Sean. Thanks.
Great. Thank you so much, Amanda, for having me back. And I'm really pleased to be following up from Iris's presentation from last week on federal issues. We are less than 2 weeks out from the start of Minnesota's legislative session for 2022. And as you're going to see, there are a lot of things going on in the vulnerable adult and elder justice space, but also beyond that, of course, as well. So here's what I'd like to go through today. I would like to first do a little bit of setting the stage for you, so you just kind of understand the bigger picture of where we are right now in Minnesota heading into session, both from a large scale kind of viewpoint and kind of a small p political viewpoint. You'll see that there's lots of things happening in 2022 after the session as well that will likely impact what will be talked about and debated and discussed for the next several months. I do want to highlight some of the dominant issues when it comes to vulnerable adults and older adults, particularly around the pandemic and staffing issues in long-term care settings. And then we'll take some time to dive a little deeper into specifically our adult protection system in Minnesota and how there will be some proposals looking at protecting vulnerable adults within the APS system this session and beyond. And then we can talk a little bit about some other issues that may come up, and then happy to answer questions. So let's go ahead and get started because we do have quite a bit to cover. So let's just set the stage real basic. Some of you might follow every single article that NPR and other news outlets put out about the session. Others of you might have forgotten that Minnesota's legislative session is really only about a half a year. We'll run through close to the end of May this year, and starts on January 31st. And typically the way Minnesota sessions work are the odd number years are a budget setting year, so that every state agency comes with a big budget requests, and there's lots of funding proposals that are debated and discussed. And in the even years, like in 2022, things are supposed to be a little bit more quiet, sometimes known as a policy year or a bonding year. There's not as much money on the table at stake. Usually there's a bonding bill and there's a lot of policy bills. That is kind of the typical year, but this year is anything really but typical. And that, of course, is because of the pandemic and because of all sorts of economic issues related in large part to the pandemic. So I think the most important thing to know about this year is that there is a lot of money potentially that the legislature could spend. There is about $1.2 billion from the federal ARPA bill that passed last year. And while we used some of that in Minnesota at last session, we saved about half of it to be discussed and debated this session. I won't say a whole lot more about that specifically in today's presentation. Happy to answer questions. It should be noted real quick that if the legislature doesn't come up with a way to spend that money that they agree on and that the governor signs, the governor will have the ability to spend that money. And he's had his own pot of money to spend. You may have seen highlights about him sending more resources to the long-term care staffing issue, which again, we'll get into. That's because he has his own smaller bucket of money that he can spend without legislative approval. That bucket would potentially grow if the legislature doesn't do something with the $1.2 billion. For those of you who follow along, then you've probably also heard that we have a record-setting budget surplus this session as well, close to $7.7 billion. And there is some discussion about what that number exactly means, and if you take into account inflation, is it really that big? But it is close to double the largest surpluses we've seen in the past. So there is a lot of state funding available potentially to be spent. And obviously both the Senate and the House would have to agree on how to spend that money, and the governor would have to sign a bill in order for that spending to occur. We still also then have the potential, if you were in last week's session, about potential federal legislation. There was, I think, great hope, especially among those in the elder justice world, that the Build Back Better plan, known as the BBB, which is federal legislation that has been passed by the House of Representatives, but is still being frankly held up in the Senate. Whether or not that bill or some iteration of it will still pass is looming. And if it does pass in the middle of our session, then we potentially have all sorts of good problems like we had last session, where there's money to be spent or needs to be spent or given to us from the federal government. We have to decide kind of how to spend it, especially in the world of elder justice, what I'm talking about. So that is still a question mark, and that could happen in the middle of this legislative session. One other thing I'll note, and I also won't talk about this much today, but happy to answer questions, is there's still quite a bit of money that local county governments and city governments received from that same ARPA bill that I talked about earlier last year. And those governments still have the ability to spend that money as they see fit. So you may see local proposals in your own county or city government, sometimes dealing with social services issues or vulnerable adult issues that is funded ostensibly through federal aid, but given to those local governments to choose how to spend it. So there's lots of issues around spending. And of course, if you're in the space and you know about staffing needs, whether it's direct care staffing or even in social service agencies, like in counties where they need staffing as well, there is a lot of, I think, unease and fair questions about, what are we going to invest this money in, and how are we going to, allocate all of these buckets of money. So we expect the governor to be releasing his budget. He's actually already started this week releasing pieces of his proposed budget. Of course, that is just a document saying what he would like to see the money spent on, and his administration would like to see the money spent on. The legislature will have their own proposals, and all of that will be worked out as the session goes on, likely without any kind of final decisions on things until till the end of May, when the session ends, potentially with a special session as well, like we've had in the last couple of years. Although those of us who are at the Capitol or are virtually at the Capitol are hoping that might be different this year. A couple other things that I think are important to know from a big picture level about what's going on. 2022 is an election year, not presidential, but very important for Minnesota politics. The governor's seat is up, and there are two prominent GOP Senate leaders who are running to get the GOP nomination, so running against each other and other candidates. So there is a lot of politics in the air, if you will, even more so than a normal year. Because individuals are ramping up their campaigns and thinking about November of 2022. And it's not just the governor. In fact, all the legislative seats are up in both the House and the Senate. And just a reminder that the DFL controls the House and the GOP controls our Senate. We're still the only split legislature in the country. And they both control those by pretty slim majorities. So there will be a very set of closely contested elections for the parties to try to remain and expand their control of the state legislature. And adding to all this are an unusual amount of retirements or lawmakers running for other positions. And so there are a lot of these races where there are no incumbents. And so there is just a lot of jockeying that's happening politically speaking, which sometimes means that, bills you're working on, if they could be seen as politically, viable, might have better chance. Sometimes folks are less likely to want to pass something because it's election year, don't want to necessarily disrupt things. So, but this is definitely in play and on top of lawmakers' minds and those of us who are at the Capitol as well. And we're not done. There's one other bit of, somewhat unique. Something that makes 2022 unique is that it's also a redistricting year. So every 10 years, going back to your civics class, every 10 years, there's a census. We had ours in 2020, and that census then will set up a redistricting. We should get news on what those new districts look like in mid-February. And so not only will every seat be up, but there will potentially be new seats and new districts drawn. Which changes, again, the political calculus for both major political parties in Minnesota. So all of this is happening. Also, we're still in the middle of a pandemic. Obviously, you're logged in somewhere in your home office, or maybe you're back in your office. The legislature has essentially announced that the House will be basically all remote this session. At least to start, and the Senate will be a bit more hybrid, which is similar to last year. And of course, We have Omicron surging. We have issues around vaccines and mandates and all that swirling in the air. And so it will be a very, very full session, to say the least. I want to now kind of pivot a little bit and start getting into some specifics around, okay, so what is all this going to look like or mean for elder justice issues and vulnerable adult and elder issues? So I would just kind of as a table setting or a level setting, remind us of a couple of things that have happened in the past. Over the last many years, there has been an effort to change Minnesota's assisted living licensure system. There was a bill passed in 2019 that really overhauled and changed how we license assisted livings in Minnesota. That law went into full effect in August of 2021, so just several months ago. And the Minnesota Department of Health is now licensing and regulating assisted livings as per the law that was passed in 2019. So there may be some small tweaks to that law, kind of the technical variety, but just as a reminder, that's kind of been one of the big dominant issues that's happened at the Capitol the last several years when it comes to vulnerable adults. I'll be talking about this more in depth later in the presentation, but the Department of Human Services has an adult protection unit that has began before the pandemic working on a redesign of the adult protection system and the accompanying statute, which is the Vulnerable Adult Act. So we'll see more about that this session as well. And then just in general, just to talk about the elephant in the room, we are in year 3 of the pandemic. Someone said the other day, wow, the pandemic is like a junior. I remember freshman year of pandemic. And it does, it feels that way. I know people who work in the long-term care and support space, whether it's people with disabilities or in the aging field. I mean, this has been, to say exhausting is an understatement. And now in year 3, we have new health challenges. We have, more contagious variants. We still are dealing with the fallout of all of the social isolation that older adults have faced, whether they've been in their own homes or whether they've been in healthcare facilities. We have, a deep crisis that existed long before the pandemic around having enough healthcare workers, long-term care supports and workers, whether, again, it's in-home care or in a facility, low wages and benefits for those workers. And then extreme staffing shortages, which we'll talk about a little bit, have grown even more extreme with the pressures of the economy and the pandemic. So we are in a space that is an important inflection point in our kind of how we care for older and vulnerable adults and people with disabilities. And I know that will be a topic in a variety of ways at the legislature this session. So to just get a little bit more specific, with the pandemic, the issues that we will be seeing, whether they are in bills or debates, are around vaccines and vaccine mandates. If you haven't been following, the United States Supreme Court just issued an important opinion around vaccine mandates. And if you just read the headline, you may have learned that they struck down mandates for large employers, and that's true. But if you read below the fold a little bit, you'll have seen that a federal rule from CMS that requires vaccines for a variety of Medicaid-funded facilities was upheld and is still in effect. And so what that essentially means is some long-term care facilities, including nursing homes, have a vaccine mandate for its employees, which makes it complicated in a variety of ways. There may be a mandate for nursing homes, but not for assisted living. That can be complex to wade through. And then a mandate, industry representatives have really been explaining that the mandate will, further compound or can further compound the staffing crisis because there are a series of workers who will not or cannot get vaccinated. Then we have the Omicron surge that I just mentioned, which is making things complex in terms of just day-to-day safety, school shut down, just managing life and testing as well. And so that will be talked about at least early in session. For a while, you will remember we were under emergency powers from the governor. And so because of those emergency powers, which have now ended, the governor there could be all sorts of rules and laws that were waived under that emergency power authority. That is gone. So some of those rules and things can no longer be waived, but we may see state agencies like DHS coming back and asking for changes because of what we learned during the governor's emergency powers. And then those powers will be debated as well. If we have another pandemic, will we want, such broad sweeping powers? There will be all sorts of arguments about yes and no for that. And then, of course, as I've already mentioned, we have quite a bit of money potentially to spend, both federal and state money. So what will that look like in terms of an economic recovery? How will we invest that money and a lot more? But the pandemic will be, front and center at the legislature. And of course, older adults, either they're living in their own home and receiving services or living in long-term care settings, are definitely a part of that conversation. I'll finish with go ahead, Amanda.
Yep, we just had a question just for clarification. Can you talk a little bit and clarify on vaccine mandates, nursing home, assisted living, Fed versus state?
Yeah, so essentially the vaccine mandate at the federal level is for facilities that essentially that take Medicaid. So that means in the long-term care space, that means nursing homes. While assisted living can take a form of Medicaid known as the waivers, those to this point, assisted livings are not covered by that mandate, and there is not a separate state mandate for care facilities. There is a state mandate for state employees, so that could cover certain state operated like group homes. That mandate, this is where things get really confusing. You basically have to create a spreadsheet or a chart to say what is and what isn't covered. That state mandate for state employees does have a testing option. So you either have to get vaccinated or take a negative test. And so that's kind of the state of the vaccine mandates right now. There's not a whole lot the state will be able to do to change that federal CMS rule around vaccine mandates. But I suspect potentially the state issued mandate might be at issue. And there may be there may be a discussion about whether or not there should be kind of a state accompanying mandate. And the pluses and minuses of that, since we now have the federal one for certain healthcare facilities. I hope that's clear as mud. And we can, I don't have any resources on that, but if you want to contact me, I can point you in the direction of certain places where you can find out way more detail. So let me briefly talk about, we can talk a little bit about the staffing issue as well. It doesn't necessarily have to be super brief. So staffing in long-term care and services, I think, will be a huge issue. Staffing in all sorts of parts of the economy, whether it's just a regular shop on Main Street or, retail. But in the care economy, we've known for a long time that we've had staffing shortages in things like PCA services, in-home services, group homes, long-term care, assisted living, and nursing homes for a long time, long before the pandemic. But the pandemic's added a lot of additional pressure on there. People have left parts of the workforce because it's hard. It's hard work. It's much harder with the pandemic and with all of the day-to-day difficulty of managing that and caring for people with disabilities and older adults. This is also a field where the pay and the benefits really haven't changed much in any sort of significant way. And so I know that nearly all providers in this space, whether it's a group home provider or it's a provider doing day services for older adults or people with disabilities, or it's an assisted living provider, are experiencing staff shortages, oftentimes higher than they've ever had before, maybe upwards of 10, 20, 30, 40% of openings that they simply can't fill because they can't find the staff to fill them. So there is a lot of talk, especially in the last couple of weeks, about certain providers needing to shut down or contract their operations. And there is a big question if it comes to that for a series of providers, obviously what happens for the individuals being cared for. In the group home world, sometimes older adults with disabilities or adults with disabilities are being sent home to their parents or other family members if they have them. Sometimes people are being shifted around to other long-term care facilities. And all of this can be very concerning around, nobody wants this to happen, providers, least of which. And so there has to be some, I think, coming together around how are we going to, one, address the immediate crisis and try to get some workforce so that we really prevent shutting down and closing down and unnecessary movement of individuals. And then two, let's also talk and try to walk, and chew gum at the same time and talk about more sustainable, permanent changes to this space. Because there was a crisis beforehand. The wages for PCA workers and CNAs and other workers in long-term care were way below what they need to live anyway, long before this crisis. And so we should look at some permanent solutions as well, especially when we're thinking about the budget picture that I laid out. So what can we expect? Well, I do think it's fair to expect bills addressing a variety of these things. Bills potentially to address, the immediate workforce. There has been deployment in the past of the National Guard for kind of that emergency piece, and we will probably continue to see some solutions kind of like that to address emergency. But we'll also see bills to address more systemic worker pay and benefits along with that. If you think about what it's like, whether you operate or work in a long-term care setting or you work with older adults who use those services, if you think about the workers in this space, making 12, 13, 14, even 15, bucks an hour, they oftentimes, that is barely enough to get by, especially in the metro area. And then if their wages are increased a little bit, all of a sudden some benefits that they might rely on, whether it's food support or childcare benefits, they may not qualify for those anymore if their wages go up. So then they hit that, really bad place to be, where they make a little too much to qualify for important benefits to help keep them out of, the deepest poverty, but they still don't make enough to really, live, to not be able to live paycheck to paycheck. And so I think in terms of the kind of holistic response to workers, it is fair to think about other, benefits, whether it's healthcare or childcare or things like paid family medical leave or earned sick and safe time that can accompany wage increases and even permanent wage increases in this space. And so that's one thing to kind of look for and think about, and will be talked about, I think, this session quite a bit. The next bullet I have there is a fairly specific proposal that came up last year and actually was talked about a lot this summer. The part of the allowance of the ARPA funding that I talked about earlier were essentially could be direct checks to frontline workers, and states have a lot of flexibility to define, well, who's a frontline worker in the pandemic? Obviously, it's the nurse at the bedside in the ICU dealing with COVID patients all day long. But as many have suggested, it's also, the grocery store clerk who has come in, or the meatpacking workers, or the childcare workers or teachers. And so there is a discussion about how to define a frontline worker, and then getting them essentially bonus checks for recognition, of their work. And so there was money. There was about $250 million set aside for both for a working group made up, a bipartisan working group to come up with that. That group could not come to a full agreement on the issues. And so I think that issue of frontline worker pay will be back in addressing at least a small amount of money going to workers. That obviously isn't going to cover, the depths of what people need. And then I think among all this will also just be kind of workplace safety, partly kind of what I just mentioned. At what point is a place so understaffed that it's not safe for residents, it's not safe for staff, and what provisions will be in place to deal with places that do have to close. I think those are open issues and important issues, and will likely be talked about, especially early in session. I'm going to pivot to another topic in just a minute. So why don't I just pause for a second, Amanda, and see if there's anything that came up that you'd like to.
We do have one question that is concerning we can talk about this a little bit later too, but concerning assisted living licensure, which, went in place in August 2021. And you touched on it a little bit, but questions around what the state, thinking about the number of the large number of assisted livings that are in the state and the new licensing system. I think what the question is getting at is what's the state doing, or what supports are there for assisted livings to achieve licensure and also meet the need. I think that's what the question is getting at.
Let me talk just a little bit kind of broadly speaking, and hopefully can kind of get to some of the concerns. But obviously, if I don't fully address it, feel free to reach out directly. So, when in talking with the health department, they have revamped a lot of ways how they regulate nursing homes and how they go and actually do what they call surveys, which is essentially a licensing inspection. They have a lot more places they need to visit now, and the way in which they do that, those visits has changed. They are reporting that they are, essentially keeping their heads above water when it comes to kind of those that surveying. So in terms of kind of getting all of these facilities licensed and up and running and have the system kind of working the way it should, they have not reported, and I haven't seen any kind of like big blaring, red flags. Oh, this licensure thing is not working. I would say, top line report is it is working, and the health department is funded and staffed and staffing up to kind of regulate that industry and make sure that law is being followed. They also have in place, systems to then accept new applicants to the system. And so there's a whole process that a provider would have to go through to get to apply and then be approved for licensure. And that's all set up at the department as well. I think, a couple of things that have come up that may be at issue. One, from what we've heard from the department, and those of us, who advocated, and the Elder Justice Center was advocating for this law and that we need this law. A couple of things that have come up. One, a lot of the facilities, a bulk of the facilities are smaller facilities. So when you think of assisted living, you might think of a 75, 100, 115 person, facility. Most places are much smaller than that. And there's a huge variety of them, big single family homes or, small little apartments. And there are, so as the health department has gone and really kind of started boots on the ground, inspecting and surveying these places, I think there's a lot of like, well, I'm glad we're out here type of things, stuff like, basic smoke alarms and that kind of stuff that they've surveyed for and found lacking in a lot of places. So I think the fact that we have the licensure and that the health department is up and running on that is really good. It's really good for the health and safety of residents. A big part of that law was also making sure that if a resident is terminated from their services, that they have a due process protections in that. And they also have a process for a safe landing. if they are forced to move. So all of that stuff is kind of up and running and working. On the flip side of of that, there's questions around for some facilities, especially smaller places, are there parts of the law that weren't really designed kind of necessarily with them in mind. One thing that I think specifically has come up is and this was being raised as the conversation was happening, so it's not like it's out of the blue. But as you regulate more, there could be more costs associated with that, depending on certain types of regulations. And especially for the population of older adults who need our Medicaid waiver system. I've referred to that before, but essentially an elderly waiver or a disability waiver, which is essentially a ticket into assisted living. It pays for assisted living if you're Medicaid eligible. The providers do not have to take that, but those who do are generally reimbursed at a lower rate than they can charge private clients. And there is a question about whether or not those rates have or will keep up with the actual regulation. And so I think that's a TBD, and definitely continuing as licensing continues and the department learns more. I mean, I think it's only in month 5 now, but after we get us, at least a year or more of licensing data and kind of fully understanding the breadth of complaints from both consumers and providers about the system, I think there'll be potentially some issues on the table to think about tweaking. But again, I think the top line takeaway on assisted living licensure is that it's working as intended, and the health department is able to regulate and enforce as generally speaking as the law has intended. All right, so then I'd like to switch to kind of the second half of our specific topics, and I'd like to talk about specifically protecting vulnerable adults. And where we're going to pivot to here are for older and vulnerable adults who live in their own homes, really in the community. Again, many of you are aware of this, but just as a reminder, if you're newer to this field, the Vulnerable Adult Act, which essentially helps protect vulnerable adults, whether they live in a long-term care setting, like an assisted living we were just talking about, or they live in their own homes, was developed 40 years ago. And there's essentially 3 different agencies that are tasked with investigating potential cases of abuse, neglect, and financial exploitation, essentially protecting vulnerable adults where there is an allegation or a fear that the vulnerable adult is being mistreated. So the health department is one of those investigators, and the Department of Human Services are one of those investigators. Those 2 state agencies, which are state agencies, not counties, they investigate facilities. And so we just talked about the health department. They'll look at things like nursing homes and assisted living, and Department of Human Services will look at places that are licensed by DHS, so group homes being a key example of that. So the third category is really what we're zeroing in on here, and what will be a topic at the legislature this year and in coming years. And so that is our adult protection system. And this is a county-based system. So every county has an adult protection unit. You can think similarly, at least big picture wise, as a child protection unit. This adult protection unit responds to allegations of abuse or neglect against a vulnerable adult when that vulnerable adult is living in their own home. This might be oftentimes an adult child or grandchild that is suspected of the abuse or neglect, sometimes a stranger when it comes to especially financial exploitation. And it can also be the adult themselves, which is known as self-neglect. Essentially, that person has some sort of impediment where they're not able to take care of themselves and putting themselves in significant danger. So a brief history of kind of our adult protection system is that it has largely been reliant on county funding for the 40 years or more of its existence. Unlike child protection, there's no dedicated federal funds. Only in the CARES Act. This is very inside baseball. Did we finally get a little bit of money directly for adult protection? And if the BBB passes as was originally envisioned, or parts of it pass, we might get more federal funding. But essentially, for all intents and purposes, there's almost no federal funding for sustained adult protection work. And then our state funding for this work has also been very minimal. So essentially, a county, when funding its adult protection unit, unlike its child protection unit, most of the money is coming from the county itself and the county levies and the county dollars, which of course have to compete among a variety of other county services. So because of this, and also because of just a lot of changes in the field itself, things like person-centered planning and dignity of risk and other ways in which we have changed our belief around a more paternalistic model in working with vulnerable adults to a more person-centered model. DHS began a process prior to the pandemic, before COVID was even a word in the dictionary. DHS began this process, and they did a huge outreach to counties and stakeholders like MEJC and others and providers about, okay, what are ways in which we want to update, modernize our adult protection system for vulnerable adults, and then what accompanying changes might we have to make to the Vulnerable Adult Act to help with those changes. So that redesign process was just getting going and it was just starting kind of its legislative work when the pandemic hit, and basically everything froze for a while in state government. So now that we are living with COVID and things are eventually returning to some different state of normalcy, this effort is back. And so last session, DHS introduced HF 1432 House file. It also has a companion in the Senate. And it's kind of seen as DHS's phase one, essentially, of starting this redesign work. Some other initiatives within this work are to take a look at our system. And for those of you unfamiliar, an adult protection worker has a big job when they open a case for a vulnerable adult. They have to investigate the case, similar to how law enforcement might investigate a potential case and figure out, was there maltreatment committed and who committed it, and basically come to a decision and do the investigation and then write up a report to justify their decision. At the same time, simultaneously, they also have to wear kind of a social worker's hat. They have to provide services or refer the vulnerable adult and family to services. This is especially important in cases of self-neglect or potentially a family neglect, where the family isn't so much intending that the adult get harmed, but they simply don't have the wherewithal or the means or the training to care for an aging relative or a person with disabilities in their own home. So that's a lot of work for an adult protection worker. The statute itself focuses a lot on the investigative side, not so much on the services side. And so the question is raised, how can we support our adult protection professionals and our county units to kind of bring that balanced approach, and how can the statute reflect our learning over the last decade or more, that vulnerable adults, even though they are quote unquote vulnerable and have challenges, they also should have some say in their own care and the outcome of their cases, to the extent that they're able to direct that. So those are some of the issues in phase one and beyond that DHS will be intending to bring in future years as well. So we've had all of that going on with adult protection. And then in July of this past year, a DHS commissioned report came out that is relevant to all of this redesign, but it was specifically looking at a particular problem that is somewhat unique to Minnesota, and that is about what cases we actually choose. By we, I mean adult protective offices within a county, which cases they actually choose to accept for investigation and services. Because of the funding mechanisms that I talked about, offices in adult protection offices cannot take every case. They can't even, in many cases, take half the cases that might be eligible. They have to pick and choose. The statute allows them to create priorities to prioritize, the highest need cases or the cases that they're going to prioritize in their county. And even with those prioritization guidelines, counties have quite a bit of discretion in terms of what cases they choose. So the report was released in July of 2021. And I'm not looking at the chat, but I think we'll be able to kind of send a link to that. It's a long report, but if you're in this space and you haven't read it yet, I highly recommend you do. Here are the top line takeaways.
Just posted in the chat.
Great, thanks, Amanda. Thank you, Renee. So here are the top line takeaways. So unfortunately, Minnesota does lag quite a bit behind the national averages for cases that we accept for investigation and services. National average is somewhere in the 60% range, and we're floating around kind of the 25% range. And the report gets into details about kind of why that is. But essentially, because of that county discretion, because of our funding, it's a complex formula that leads to this disparity. But ultimately, when it comes down to it, most Minnesota counties, are far behind the national average for cases that could be investigated or not being investigated, or taken for services, or both, as I mentioned that they have to be. And then again, as a state, we are about at 25%. And so, needless to say, our office, I think other advocates and the Department of Human Services and the report itself, basically concludes that this is not acceptable. It's not where we should be. And there are a variety of things, recommendations in the report to try to address that disparity we believe, funding is a part of that. That is not a recommendation in the report itself, but I'll talk about that in just a little bit. In addition to the actual disparity of cases accepted, at a national level, probably unsurprising, in Minnesota, we also have racial disparities in terms of case acceptance rates as well. And so there was a statistically significant finding in the report that cases where the vulnerable adult is a person from the BIPOC community, those cases are accepted at a lesser rate than when the vulnerable adult is white. So that is problematic, although unfortunately probably not surprising for a lot of the other issues we have with racial disparities in Minnesota. And then another, whether it's a surprise or not, another statistically significant finding was that the type of disability matters as well. Specifically, individuals with mental health and chemical dependency issues are screened out at a higher rate than people with other disabilities. If you think about it just kind of from an anecdotal standpoint, you have a vulnerable adult who might be pretty clearly in a stage of self-neglect, but the root issue is chemical dependency, and addressing that case, with for anyone who deals in the mental health field or with chemical dependency, takes at least some initial services and high level kind of support services to address issues that may have been going on for a very, very long time, as opposed to, say, a physical disability or a cognitive change that is a little bit more sudden and recent. And again, because of county discretion, they are allowed to choose which cases they take and don't take. And the study found that there was a statistically significant, again, finding that people with chemical dependency are screened out at a higher rate. And then there's also a fluctuation in geography. So even though the statute doesn't say, a vulnerable adult is different, whether they're in Kittson County or St. Louis County or Brown County or Hennepin County, the results, because again, our funding are different. And so if you're a vulnerable adult living in one county, you are going to have a different experience, whether or not your case is accepted or what happens after it's accepted, than other vulnerable adults facing similar issues in other counties. And so all this taken together, it shows that we have some work to do. I just went through this in more detail. So we have some work to do, and so some possible solutions that really need to be thought about are, the redesign itself. Let's talk about emphasizing services and interventions that will help the vulnerable adult, not just the investigative piece, which is good to help law enforcement potentially pursue a case, and it might be good to kind of as an initial triage. But if the vulnerable adult is going to recover or meet their own goals, whether it's their grandson who's physically abusing them or whether they are chemically dependent and neglecting themselves, ultimately it's going to be services that person is connected with that will make a more lasting change than say prosecution of an individual. And so how can we emphasize the services part of our system in the work and in the statute? Funding, I've mentioned that before. We know that this is a place where the state and the feds have fallen woefully short in terms of supporting counties to hire enough social workers and to do some more creative work when it comes to addressing the needs of the vulnerable adults in their communities. And rather than basically just have a system where every county gets to have a long list of prioritization guidelines to basically say, well, we don't take these cases because we don't have enough people to do them. What would it look like to have a system where counties are accepting cases much more at the national average and have the professionals trained and able to do that at a higher level? We would want a system that is envisioned to do that, which we simply don't have now, and a big piece of it is the funding. And that hopefully, of course, both of those together would lead to more statewide equity and access to services. Now, specifically when it comes to those disparities in racial demographics and disability type, we will need some more, I think, targeted interventions specifically to address those issues as well. And so you can see a variety of things that could be on the table and hopefully should be part of a discussion. While in the past several years, we've talked a lot about our long-term care system at the facility level, it's definitely time we remember that most people who are abused when they're an older vulnerable adult, it happens in their own home, it happens in the community, and our system that's set up to protect them, adult protection, it has a lot of area of growth and funding to go.
Sean,
go ahead, Amanda.
Question. I'm going to let you answer, even though I'm pretty sure I know the answer. The question about the evaluation that was done of the by DHS. Any breakout in the results based on age for over 65 versus under 65, or were the findings all categorized based on the callers, which are in Minnesota vulnerable adult and not age based?
Yeah, so the organization that did the work they're called Guidehouse, and they have a great description of their methods in the report, so you can see it. But they went through and used all of our adult protection data that is available, and because we are a state that we're not an age-based state. Some states do their adult protection by age, but we don't. Any person over the age of 18 who fits the definition of vulnerable, and we could do a whole webinar on what vulnerable means, and we have, haven't we? Essentially, so if you meet that criteria, then you're a vulnerable adult. And I would have to go back in, but I do not believe then Guidehouse went separately and broke up any findings of age. They just used they used the data that they had, where a person's age, I think, is part of the data, but they didn't go that deep into the analysis because our system doesn't really discriminate when it comes to age. I know we're nearing time, so this is my last slide essentially, and it's basically a wrap up. I would invite any other questions. Amanda, I would also invite any addition from you for the topic we just talked about. Two other things just to kind of keep in mind. One of the things we worked on last session, and I would say is one of the biggest issues to still address in the assisted living world, for reasons we're not going to get into today, certain assisted living facilities in our state that are essentially assisted living, but are the rent portion is controlled by HUD. So it's a public housing building, for example. Those settings, where there's several dozen of them around the state, they were exempt from licensure. And the question is, what should happen to those settings when it comes to making sure that the people who live there, their services and their housing are regulated at least on par with assisted living? Because unfortunately, the way it works right now is you could have one of these HUD assisted living facilities right across the street from a private assisted living facility. And the private assisted living facility is fully regulated, as we've already talked about, by Department of Human Services. The HUD one is not. They're different. And so what should we do about that gap, if anything? DHS has started a working group and hired a consultant agency to really dig into this question and do some research and come up with some recommendations. That won't happen until the end of this legislative session, so don't expect that issue to be solved this session. But it is an important one to kind of keep top of mind when we're talking about what is more to be done in the assisted living space. And then there's always potentially proposals to look at financial exploitation, abuse, and neglect. I think especially with the pandemic, we learned a lot about social isolation, or the public did, in ways that they hadn't thought about before. Things around caregiver neglect and exploitation, especially with caregiver burnout, plus all sort, scams are always going to be going on, and even more prevalent because of the situation people find themselves in, being stuck at home more, and all sorts of government benefits kind of flying out. There's all sorts of confusion. So there could be some more proposals, maybe on the criminal side, to deal with some of these issues that might pop up, and we'll be there to kind of analyze them and advocate for the ones that do it in a smart, balanced approach if they happen. So, Amanda, anything else to add?
Yeah, a couple of things. Mary McGurran from DHS let us know, and the attendees know, page 123 of the Guidehouse report does have some data breakdown based on age. So the link to that is in the chat. We will also, when we send out the CEUs, will also include both a link to the prior webinar and the Guidehouse report again. So you'll get that via email. We have just a couple minutes, and we do have another question slightly related to this. We could do a whole nother webinar with DHS on this APS, and maybe that's what we'll do. But talk a little bit about, Sean, or I can, about what gets investigated from APS. So when calls come in, are they broken down into categories like a sexual assault or financial exploitation, neglect, maltreatment? And the answer is yes, and that is not in terms of we will, they don't determine what gets an investigation based on what type of maltreatment, but they do categorize APS, and you can see it on DHS's website. They do categorize based on what the call was, or what the maltreatment report, which type of maltreatment or abuse one was either experiencing or the complaint was about. So I hope that answers that question. Sean,
yeah, I think that's a really good question, and I know if you read the report, this will get a little bit more illuminated, because it is pretty complex. So Amanda's right that a county isn't sitting there being like, okay, well there was a rape, and then there was an assault, and then there was a financial exploitation. So we're going to choose to only do the rapes because they seem a lot worse, right? That's not necessarily what we need by priorities, but the prioritization guidelines, a good example, might be within the financial exploitation category. We're not, as a county, we're not going to investigate anything where the amount is, less than a certain dollar figure. I'm just pulling out, but less than $3,000. We're just not going to investigate those cases kind of categorically. We can't. That's one of our priorities. That's kind of an example of the prioritization. So those guidelines will kind of shape some general rules that counties will follow. But what the report really highlights is that there's another level of decision making that happens at the county when they're screening a case, and they do look at things, and they have the option to hit, to screen a case out and say other, why did you screen it out other? And that other box is filled, for all sorts of reasons. And the report gets into going through a lot of those other boxes and finding out some of those reasons. A big reason why it happens a lot is that, well, this vulnerable adult has a case manager, say a waiver case manager, or has connection to some case management services. And so at least they have, some eyes on their case. That can be a big reason for a screen out. We won't, necessarily debate the merits of that right now. The report calls into question that being kind of the only reason you might screen out a case. And we definitely know that when it comes to services, we would want adult protection to be funded enough so that they don't feel like they just have to pass the case on, but they could work with that case manager to really get at some of the root issues. So that is again, Amanda's right. We could go really in depth, but that question really hits at one of the issues the report is getting at, and why we need to better fund counties so that they don't have to make super hard decisions, and we can be investigating, all the cases that need it and have merit. So
we are
that I think, yes,
we're at time, unfortunately, so we do have to stop. I know that there's a couple questions still in the Q&A. I think what we will probably do is try and set up another webinar, maybe focused on APS with some of our APS friends, and talk about some of these cases. So more later, but you will receive an email with information regarding today's presentation. Feel free to reach out to Sean or myself if you have questions about this, and we will be in touch. We can do another policy webinar too throughout this legislative session as things change. So with that, Sean, thanks for joining us, and participants, thank you for joining us today.
Thanks, Amanda. Great questions, and we'll talk to you all later.